institution partner who has been leading the research component and helping us with this project. And then we have the community who represents the 3 different groups who have been impacted by this project, which includes Solano Pride Center for the LGBTQ community, Fighting Back Partnership for the Filipino community, and Rio Vista Care to represent the Latino community. And before we get to our next slide, it's my pleasure to introduce my friend and colleague, Dr. Sergio Aguilar Gaxiola from the UC Davis Center for Reducing Health Disparities. He is the director there, and Sergio will provide an overview of the ICCTM project. Good evening, Sergio.
Good evening. Thank you so much, Jonathan, for that excellent introduction and overview of what is remarkable, our Community Forum 3.0. It's just remarkable that after a few years of being together, you know, it feels like a family, quite frankly. And I'm so glad to see you again. And thank you for the excellent introduction again.
It's good to see you. Thank you.
Yes. Well, I want to extend my warm welcome to all of you and to thank you for your interest in an update that we would like to share with you of this remarkable project. And I mean it. You know, I had been very excited right from the go, and my excitement has continued throughout the years that we have been working together. And just as a brief overview, the project started actually several years ago when the leadership from Solano County Behavioral Health Division came to visit us at the center that I direct. We met with a group of 4 people then, including the director at that time. And what they presented to us was this information that portrayed the historical, you know, disparities in 2 communities, two population groups. If you take a look at the 2 bottom lines, those are Latinos and also Asian, but Asian in Solano County means primarily Filipinos. You know, 76% at that time were comprised of Asians. Americans were comprised of Filipinos. So what they presented to us is the underutilization of services by these 2 population groups, and we started discussing, and they presented the needs of the county, and we jumped to the idea to the opportunity to work closely, not only with the county but with community-based organizations like the ones that you will hear from today, and several other community partners. So what I want to just emphasize is that at that time, they also said that they were interested in LGBTQ individuals, but the county was not collecting data on gender identity and sexual orientation at the time. Now they are. You know, it's one of the things that the county has been doing now for some time. And my colleague and friend, Tracy Lacey, will present a little bit more of that information that is more current. So this information was right before we started the project, and we started in January of 2016. Next slide, please. So this is a very brief overview. This is a 5-year project under the innovation component of the Mental Health Services Act. And we focus, as I mentioned to you, in three priority populations that have been historically underserved. And those are Latinos, Filipinos, and LGBTQ communities. And the framework that we have used right from the go is the nationally recognized cultural linguistically appropriate services standards, or CLAS. That's the acronym. And as far as we know, this project is the first of its kind combining the CLAS standards with community engagement. And there has been indeed a strong focus on community engagement. So just to give you a sense, during the first year, a little bit over a year, we engaged in these comprehensive health assessments precisely with these three communities of focus. And we did a series of community forums like this one, and also focus groups throughout the project. We did some, key informant interviews. And also what we did was to develop training and facilitating the training, which was based on the CLAS standards for not only the county stakeholders and the three community-based organizations that we primarily have been working with, but also representatives from other sectors, social services, churches, schools, law enforcement, and other sectors. And as a result of this work, and we had three different trainings, three different cohorts, those persons who were trained, they develop quality improvement or action plans that were designed to improve mental health services delivery, and of course, access to care as well. Next. Right from the go, this project was guided by goals and outcomes. And what you see here represented is that I described to you the communities that we were focusing on, had been focusing on. And the main purpose there has been to increase meaningful community engagement and partnerships and relationships, building trust, and also to increase awareness of mental health services, and also focus on decreasing stigma. That we know stigma really is a barrier to accessing care. We also use the framework of the quadruple aim that has 4 different outcomes. As you can see on the screen, one is to improve the consumer experience or consumer satisfaction. The other one is to increase or improve outcomes, health-related outcomes, improve provider satisfaction, and also while reducing per capita cost. And the long-term impact that we have been looking for is to increase access to care and utilization of services. And all of this under the framework, once again, of CLAS informed care. Next. So this is just to illustrate, as a result of those 3 trainings that we did with very, very diverse representatives from various sectors, they developed and refined, and now these quality improvement action plans are being implemented. What you see there is 14 action plans. And the names that you see within each of the circles are the names that the developers of these action plans gave to the action plans themselves. So some of these action plans are going to be described in more detail And with that, next slide. I would like to introduce one of our key partners, and that is Fighting Back Partnership. And the program manager of this particular project for Fighting Back Partnership is Erica Parpan. So Erica.
Thank you, Sergio. Hello, everyone. My name is Erica Parpan. I'm the project coordinator from Fighting Back Partnership, working with the Filipino-American community with goals to raise community outreach and engagement efforts in the Filipino-American community by talking about stigma and barriers to care, and also to raise awareness through social media by working with cities and the county to create council proclamations and board resolutions. So in 2018, groundwork was done to create a coalition, Filipino-X Mental Health Initiative, Solano, with community members invested in mental health, both professionally and personally, with a mission to empower the Filipino-X community by providing early intervention through education and access to resources leading to a resilient community. So naturally, after establishing the coalition, we wanted to secure a space for youth to learn about their mental health and culture with Philippine-X Youth Coalition. Collectively, with the coalitions and community partners, we were able to introduce mental health to the Filipino-American community and the community at large in May of 2019 at the Rise Up community event held in Vallejo. Last year, the city of Vallejo presented a city proclamation recognizing May 11th to the 16th of 2020 as Filipino Mental Health Awareness Week. Back in 2019, 17 individuals were trained to become community trainers with funding secured from Solano County Behavioral Health for the Tulong Alalay at Gabay, or help, assistance, and guidance training. So TAG, the foundation comes from evidence-based programs such as mental health first aid, and it's culturally tailored for Filipinos. In the last year, FMHI Solano hosted 4 virtual community trainings. Our participants came from Solano County, neighboring counties, and we even crossed state lines. A couple lessons learned. We have limited access to Filipino-American clinicians, and it's especially with those that are Tagalog speaking. Another is we only had a couple years with this project, in addition to the pandemic that limited our community outreach. The Filipino community would really benefit more from continuous exposure to mental health awareness, the language used to describe symptoms, and resources to help further reduce stigma and normalize mental health in the Filipino community. And could I get the next slide, please? So now I'd like to invite you to hear about Dr. Scarlett McClure's experience with FMHI Solano.
Hi, I'm Dr. Scarlett McClure with Kaiser Permanente in Vallejo. I've been here in Vallejo for the past 14 years working in the Department of Geriatrics and Home Health. I was first introduced to the Filipino-X Mental Health Initiative by a colleague of mine, Dr. Jeannie Celestial, who's a psychologist here at Kaiser Vallejo. And over the past 2 years, attending our monthly meetings, now on Zoom, I've been able to forge some solid friendships with community members, with church leaders, with teachers, and even graduate students and youth in the Filipino community in Vallejo. We all come from different backgrounds, but we come with a shared purpose of reducing stigma and sharing and spreading resources for mental health services throughout the Filipino community. It's become increasingly helpful to be associated with FMHI over this last year, since my work has really shifted over to helping patients and their families deal with the social isolation and grief associated with pandemic lockdown. And over the next year, I hope to continue working with FMHI to bring the community resources in dealing with anti-Asian racism, as well as healthcare worker burnout and caregiver stress. That's really what brings me back month after month to work with the community. I've realized that over the past 10 years that you can't begin to treat a patient or help out with healing unless you know where somebody is coming from. And since I don't live in the community of Vallejo or Solano County, the association with this group, FMHI, has really helped me to become more involved with what resources are available in this community. So thank you.
Can I have the next slide, please? So up next, I want to invite Mauricio Rodriguez to share about Rio Vista Care's work with the Latino community. Thank you.
Thank you, Erica, for that warm welcome. Hola, mi gente. Sí se puede. You know, it's a privilege to be here representing Rio Vista Care today. I took a look at the attendees and I saw Linda, who was part of the RVC board. So Linda, on behalf of Rio Vista Care and UC Davis and our collaboration, I really appreciate this opportunity. You know, I remember it like it was yesterday, from our first interview with Rio Vista Care on an extremely hot day on July 2016, where we discussed community-based solutions to raise mental health awareness and education. To now, I'm able to be reporting that we have 5 Latino Spanish-speaking graduates from the first ever NAMI Spanish language, family, a family, or in Espanol, familia, familia class in Solano County. You know, the Latino community spoke and we listened. With the commitment of Solano County and the collaboration of UC Davis and the community members' confidence that was entrusted in the Solano County Innovations Project, we learned and addressed lessons together. We learned that a trusted community partner is needed to deliver the mental health message. We have to be flexible to meet people where they are, and that was evident in the community engagement efforts of Rio Vista Care, with examples such as the mobile Mexican consulate and the mental health 101 workshops that were given on a school where they had a new parent center right there on Washington Street in Fairfield. I have the pleasure to introduce Melida Carrillo, and she was having some type of difficulties in terms of getting on. So it's just a testament of some of the challenges that our community faces to get on here. I'll give the introduction. If by any chance Melida is not on at the time, we will move on and I'll have her present later on. You know, Melida Carrillo was a key informant interviewee who became the Latino voice for her community and a dear and honored friend of mine. I'll take a look to see, Melida, if you're on. And if not, we'll move on and I'll get her to join us. I don't see Melida on, so we'll move on. And I want to turn it over to a colleague of mine, Felix Dooley, to share the wonderful work that's being done in Solano Pride Center. Take it away, Felix.
Thank you so much, Mauricio, for such a warm and welcoming introduction. I am a newer recruit to Solano Pride Center, and I am thrilled to be here to be able to share this with y'all. Our first goal was to establish an alliance between Solano Pride Center and Solano County Schools, supporting both students and faculty through collaborative events and the exploration of an intern program in service of the LGBTQ+ community. Our second goal was to establish a relationship between Solano Pride Center and LGBTQ affirming faith-based organizations through training, engagement, and collaboration in service of the LGBTQ+ community. Some of our highlights and achievements have been Solano Pride Center has supported students and educators across Solano County We currently have a Welcoming School Summit coming up on April 24th, which I will be a part of, and I am so excited to be able to share that with our community. We also successfully hosted roundtable discussions with faith communities, LGBTQ plus clergy. Many of these discussions happened within our own Rainbow Seniors group for people 65 and up. We have also supported Solano Pride Center's Rainbow Seniors program, as I mentioned, by reducing stigma and isolation among LGBTQ plus seniors, which is still happening to this day. We have learned many lessons, but just some of them have been that systems changing definitely takes time. We also have great community partners that have helped us along the way, and that the LGBTQ plus community is incredibly resilient. And I think that just like Mauricio shared, a testament to that is all of you being here in the middle of a pandemic. So thank you all for your time. It is my great pleasure to introduce Maria Isip Batista, a member of the Solano Pride Center Board of Directors.
I'm very grateful to be part of the conversation this evening. It's been amazing to see how all of these investments in our community have had such widespread impact. As somebody, we lived, my family and I, in Vallejo for a number of years and now live in Benicia. I'm a parent in the community. I've been a faculty member of the Solano Community College school for a very long time, like about a decade now. And it's been very meaningful. It gives me great pride to see our community really flourish and have greater support in these important ways. So in terms of the work that the Solano Pride Center has been able to put forward into the community by way of this partnership, Felix mentioned our programming specifically around LGBTQ seniors in our community, reducing isolation, a very successful program in creating a luncheon event that's been ongoing, where people were able to really forge connections and relationships, to provide training to service providers in the county who are serving the specific needs of LGBTQ plus elders. Also the Proud Allies programs that is multi-pronged in terms of developing relationships and helping to build capacity within community institutions like Solano Community College and like school districts across the county. So in doing that, we've been able to forge partnerships with wellness centers that are embedded within the schools, support Gay Straight Alliance student organizations, and LGBTQ students also directly, and also parents who are supporting their youth and people within their families through processes of coming out and just getting to be comfortable in their own skin as an LGBTQ plus person. Also, the work around communities of faith has been particularly inspiring, and seeing the ways that we can kind of as a collective look across the different communities of faith to build capacities, to see ways that different faith-based communities can have greater acceptance of LGBTQ folks, to help folks understand the way that collective trauma within our community has sometimes been, has come from ways that organizations of faith have sometimes failed to include our community. And then also, as Felix mentioned, we hosted 3 roundtable discussions in Benicia, Suisun City, and Vacaville, and did a lot of work to reduce stigma around mental health for LGBTQ plus within the faith-based communities. So has been a great pleasure to be a part of the work, and are very thankful for the infusion of resources. Thank you.
Thank you so much for sharing, Maria, and you have been just an incredibly integral part of this project. So thank you for all that you do. And if we can go ahead and move on to our CBO Joint QI Action Plan. So this plan aimed to develop, share, and implement strategies for Filipino-X and Latinx LGBTQ plus communities by creating a queer trans people of color, otherwise known as QTPOC group. So we did a few things. We developed marketing materials for the group, as well as providing co-located groups and activities in each other's spaces. We recognized the intersectionality between all of our different CBOs communities. So we created QTPOC Pizza and Game Night, which was a massive success, as well as the Q Chat, which the Solano Pride Center took on facilitating. by Adrian Asbin, who I was lucky enough to be able to have the torch passed on to me through him. So definitely want to give a thank you to him for all the hard work he did before me. But both of these were very, very well received by our community and provided a great opportunity for everyone to understand our CBOs and our action plans.
Okay, can everybody hear me?
Yes.
Thank you, Sophia. Hi, my name is Tracy Lacey, and I'm totally excited and thrilled to be here with you tonight. I am a Senior Mental Health Services Manager with Solano County Behavioral Health and the MHSA Coordinator. So I have the privilege to share some information and updates about the community-defined QI action plans that were developed as a result of a Solano-specific training curriculum that our UC Davis Center for Reducing Health Disparities partners developed. It was basically taking the class action or the class standards and blending them with the community feedback that was collected during the health assessment that was done during the first year. And there were multi-sector partners, 51 folks that participated in 3 training cohorts. And then they were broken up into smaller groups, and they came up with community-defined action plans for us to really address some of the health disparities that we've seen here in Solano County. I'm going to do a little shout out to my friend Nestor, who has put in the chat some information about MHSA innovation funding. We didn't focus necessarily on doing an orientation of MHSA, but this is a unique funding source that is focused on addressing disparities for underserved communities. And it allows us to do programs that have not been done in other places, and we usually get a 3-year time frame. And in this particular program or a project, we got a 5-year time frame. And so it's been very exciting. So I'm going to go forward and ask for the next slide, please. So this first QI action plan, the LGBTQ plus ethnic visibility plan, this was developed by a group of folks that really wanted to focus on the intersect of the 3 communities that were the primary focus of the ICCTM project. Their goal was to create a signage campaign to really bust stigma related to mental health and also the stigma and discrimination for the LGBTQ plus community. They held their own focus groups with Latino LGBTQ community members and Filipino LGBTQ community members. And those folks really informed the visuals that you're seeing here on the screen and the languaging that was used. I do want to highlight for the Filipino focus group, they were aware that the word bakla has a negative association, and they were very intentional in terms of using this word to really change the narrative and assign a new, more positive meaning to this word. There were 7 posters developed in total, and 450 of them have already been distributed across the county to community locations such as restaurants, grocery stores, businesses, health and behavioral health clinics, as well as school wellness centers. We have another 500 posters that just came in, and we'll be distributing those as well. And I do want to highlight that we have enjoyed this project so much and really taken it to heart that we are engaging the African American and Native American communities to develop similar signage campaigns. So if I can ask to have the polling question launched at this point, that'd be great. So have you seen the LGBTQ visibility posters in your local area? If you can go ahead and answer that, we're just curious to see how much this has gotten out there. I think we can go ahead and close the poll. Did we get responses? Okay. Oh, so we got some work to do. Some people have seen it and a lot of people have not. So we'll continue to get those posters out there. So if we can go ahead and move to the next slide for me, please. So Taking Class to the Schools, this QI action plan was developed by a group of educators from Solano County Office of Education, our local CELTA, and an adult education representative. The goal and the idea was to bring mental health and wellness to school sites across Solano County. We were very intentional in terms of hanging materials that represented diverse cultures and in different languages, including creating spaces that are inclusive for LGBTQ students. Each wellness center or room, there are stations such as a yoga station, art station, station for folks to go listen to music, and places for people to get resources. I do want to highlight that Solano Youth Voices was enlisted to do focus groups with students in the K through 12 schools. And then we had a research student from UC Davis did the focus group for the Vallejo adult education site, which is the picture you see here on your screen. The purpose of the focus groups was to get an idea from the students what colors they wanted in their wellness center, what kind of activities, and who they would want to have in their wellness center. This is important to highlight. They really overwhelmingly said they wanted a caring adult, but not necessarily a clinician. They wanted to be linked to services if they needed services, but it didn't really matter if they had a therapist in the room or not. So it could be a librarian, a school bus driver, and you'll hear a little bit later about a faith collaborative where we may have volunteers from faith centers that will help with our wellness centers. So we have funded 35 wellness centers in K through 12 and adult education sites across Solano County. And we have partnered with Solano County Office of Education, who were funding to implement the overall wellness center initiative in Solano County. We're excited to share that we'll be funding an additional 8 to 10 wellness centers before the end of the school year. 5 of these wellness centers opened before COVID impacted all of our lives and schools had to close. As schools are opening, these spaces are going to be really important for young people to go get support and really access points for mental health services. There is a new faith and education collaborative group that Solano Office of Ed really helped launch, and there are faith volunteers that are potentially going to be working in the wellness centers. Next slide, please. The True Care Roadmap QI Action Plan, this group of folks really wanted to create a community-friendly resource guide, and they didn't want it to be this, 50-page long brochure. They really wanted to have an easy, quick resource map that individuals who needed to get linked to basic services could use easily. So they wanted to make sure that there was access for behavioral health services, basic needs, crisis services, housing, etc. They worked closely with a graphic designer to create a map that represents Solano County as well as our diverse communities. Next slide, please. This True Care map has been developed in English, Spanish, and Tagalog. There's paper versions of it. They're actually posted on our website right now on our access page. You can download them and distribute them. We also have thousands of them that just got delivered, and we'll be distributing them to family resource centers, to libraries, and to different community organizations that are potential access points for folks. The True Care Map was also developed interactively, an interactive version that's on our access page as well. So you can go on to that page, and it, again, is in the 3 languages, English, Spanish, and Tagalog. So you click the language you want, and the whole True Care Map will change and move to the language that you're looking for. So this is exciting. These are also being developed into posters so that they can be put in transit centers, libraries, and other locations. Next slide, please. The Bridging the Gap QI Action Plan, this was really a plan that was geared to improve our outreach processes, to create tools for not just county, but also our CBO partners when we go out and do community events and do tabling. A core concept of this was holistic wellness with a focus on the mind, body, and spirit. These images you see here are samples of what was developed for a prize wheel. Lots of effort was put into making sure that the pictures and images represented diverse communities, and that you can see that it's in 3 different languages, English, Spanish, and Tagalog. There was also a backdrop that was created, a large backdrop that would be behind a table that's Solano specific with images of Solano County. Unfortunately, due to COVID-19, this particular QI action plan, we haven't really been able to launch because we haven't been able to do community events, but we're excited to be able to do that soon. Next slide, please. ICU QI action plan. This was really developed by a group of folks that recognized that our frontline staff are the first people that consumers see when they come into our clinics. So the person behind the reception desk checking somebody in, and how important it is for them to have this good customer service and to greet people, how important it is for the spaces to be inclusive for all consumers coming to get our services. UC Davis has been wonderful and has created a training curriculum. There are 3 cohorts for both county and our contractor agencies. The first cohort kicked off on March 2nd, and we're really excited to see the outcome of this. Next slide, please. The cultural game changers. This particular action plan was really focused on workforce development. You can see here to the right the Solano County inclusion statement. This particular inclusion statement is on every job posting for behavioral health, everything from an office assistant to recently our behavioral health director position was posted, and it is on there as well. The group also developed hiring questions to be used at the point of application, the oral panel, and also the hiring interview, really to pull for folks that had cultural competencies. They also made some recommendations around changing our job descriptions, which is a little bit of a longer game when we're working with unions and civil service. The other part of their QI action plan was developing career pipelines with middle schools and high schools, community colleges, and state colleges. That is a part of the QI action plan that also got a bit sidelined by COVID. And so we will be picking that back up when we're able to do so. Next slide, please. The class gap finders. This particular action plan was really anchored in making sure there was a way to really check us, to make sure that as a system of care that we're monitoring and making sure that we continue to implement the class standards. So we have our own as a county diversity and equity plan that we put forward and update on an annual basis, but this particular plan pulled for us to partner with our CBO partners that we contract with and have them actually submit their own cultural responsibility plans, and we've received 13 of these plans to date. We also have an annual workforce equity survey that we use to monitor kind of our workforce in comparison to the consumers and the community we serve. Culturally responsive supervision QI action plan. This was really focused on enhancing the supervision for the folks that are providing direct services. So there were 2 cohorts, 46 supervisors and managers were trained by Dr. Kenneth Hardy. He's a nationally known trainer, really focused on helping supervisors recognize the dynamics around race and equity and how to model that with their supervisees, and then how to help their supervisees do that with their clients and the consumers that they're serving. We also had Dr. Hardy provide some training for just our system of care in general, trauma in the trenches, and we will be having him do 2 additional trainings this spring. Next slide, please. Cultural humility champions. This action plan was really geared to help us organize our trainings better, to know what trainings we've developed, to try and find a way to have those trainings posted so that people knew that they were available. You can see here on the slide, there's a number of trainings that have been developed. This first training here, the diversity and social justice training, this is a video that was created by a group of county and CBO staff. It's been really well received. I think we've had hundreds of views. It's on Vimeo, so you're welcome to check it out. And then as Erica mentioned earlier, as part of this QI action plan, we funded the TAG training, including the train the trainer model, really with this eye on sustainability, so that we can continue to help the Filipino-American community really address the stigma within their community. And then there's been a number of trainings related to improving our linguistic services, including interpreter trainings and trainings on how to use language links. Mental health education QI action plan. This particular action plan was focused on training youth in faith centers and also faith leaders, how to recognize the signs of mental illness and really how to address and combat stigma. COVID really impacted this QI action plan quite a bit, with churches not being able to really convene. Also in spring of last year, right as COVID was hitting, we were in the process of finalizing contracts for train the trainer models for the Safe Talk Assist and mental health first aid. So we've had to put that on hold, but we are funding Living Workspace. This is an online training. This is going to be provided here in the spring. And again, this is going to dovetail into what I mentioned earlier, the Faith and Education Collaborative. So the folks that are volunteering to work and be kind of staffing the wellness centers, the school wellness centers, are going to be able to receive this training. So we're really excited about that. And with that, I'm going to go ahead and welcome my colleague and teammate, Alyssa McGuire, to do this next part. Thank you all.
Hello, everybody. Are you able to hear me?
Yes.
Yes.
Great. Thank you.
Yes.
Hi. So I'm so sorry, but the screen share disappeared right at the moment that Tracy said my name. Oh, there it is. So I'm Alyssa McGuire. I'm a project manager in the Mental Health Services Act unit here with Solano County Behavioral Health. And we wanted to check in with you after the presentation that Tracy just gave around all of those QI action plans. There's so many of them. And we're curious to just see in the chat a word that describes how you feel after you learned about the quality improvement action plans that Tracy just described. So if you could just take a minute and put a word in the chat that describes how you feel after hearing that. See a lot of really great words. I see inspired and excited and hopeful, thankful. Hopeful's coming up a lot. Me too. Engaged. I love that. And progress. Thank you. We have some folks on Facebook watching. Hello, Facebook and YouTube audience. Glad you're here with us too. They're saying that it's impressive. People feel reinvigorated and empowered. Fantastic. Thank you for all of that feedback. We're loving this. I'm going to, please continue if you want to. And in the meantime, I'm going to go ahead and pass it over to my colleague, Eugene Dura.
Actually, Alyssa, I think we have Erica first for questions. Next slide.
Oh, you know what? You're right. I skipped ahead. Thank you, Tracy. Erica, I'm sorry, Erica.
Thank you, Alyssa. We're actually going to pass it on to Mauricio. Mauricio, are you there?
I'm here. Thank you very much, everyone, for your patience. Melida was able to join, so I want to give her a warm welcome. And Melida, she'll be expressing herself in Spanish, and I'll be doing the translation in English after, but I want to re-emphasize that Melida was a key informant interviewee who became the Latino voice of our community, and she'll share a couple of works and how she's done that. And now she is a dear and honored friend of mine because of the Solano County Innovations Project. Melida, bienvenido.
Ok, muchas gracias. Mi nombre es Melida y trabajo con la comunidad. Soy parte de Voces Unidas aquí en Solano, en Fairfield. Y como dice Mauricio, he estado involucrada con el proyecto que desde el principio me pareció muy interesante porque estaban involucrando a la comunidad, ¿verdad? A los que van a servir. Me gustó mucho todo lo que estaban tocando, como lo de las barreras del lenguaje, el estigma de salud mental para nosotros como latinos y todos los puntos bien interesantes que han estado tocando, ¿verdad? La otra cosa que me gustó mucho fue también que estaban todos los, no nada más los clientes o nosotros como hispanos, pero también los que dan el servicio, ¿verdad? Y trabajando en conjunto. creo que esa fue la parte que más me gustó, que estuvieron trabajando a todos niveles, ¿verdad? Para de veras saber las necesidades de nosotros como latinos, como comunidad latina y nuestras barreras contra agarrar a servicios de salud mental. Me ha gustado mucho y también hay mucho por hacer, ¿verdad? Y yo siempre he dicho que lo más importante es que nos hagan parte de del conjunto, ¿verdad? Independientemente del idioma y de todo, somos seres humanos y todos necesitamos servicio y especialmente servicios de salud y de salud mental. Ahora con todo el avance y lo que estaba alcanzando a oír ahorita un poquito del avance, ¿verdad? Que va teniendo y ojalá que haya un buen impacto para nuestra comunidad porque de veras lo necesitamos. Yo quiero agradecer a toda Lucy Davis y a todos los involucrados porque sé que han trabajado bien duro, ¿verdad? Y ojalá que en un futuro cercano tengamos los resultados, ¿verdad? Que de veras impacten a nuestra comunidad, que es por lo que estamos peleando o por lo que ustedes están trabajando tan duro y nosotros estamos tan necesitados de avanzar en eso, ¿verdad? De tener un buen servicio y un buen, sobre todo en salud mental, ¿verdad? No sé, Mauricio, ¿va a traducir usted?
Sí, voy a hacerlo, Melida. Muchas gracias.
Ok, y les quiero agradecer, ¿verdad? A todos los involucrados y especialmente a los que tienen el poder de hacer las cosas, ¿verdad? De hacer los cambios, ¿verdad? Muchísimas gracias por su invitación y por todo lo que están haciendo por nuestra comunidad.
Muchas gracias, Melida. Melida shared that she represents a group called Voces Unidas, which meets at Fairfield. And I had the opportunity to engage in dialogue with this group. She was extremely happy with this project in terms of what the details were focused on language and stigma mental health associated with Latinos. As a Latino, she also mentioned the different levels of this project. So it's not just the Latino communities, but also providers who are providing the services. She said that this project focused on all levels of necessity, which meant from grassroots community-based organization, county, physician level, mental health levels. And the most important thing, independent of what people are saying in terms of language, is just a reminder that they're human beings in need of services and treatment. She also said that she likes that the project is advancing in the impact. She wants to thank UC Davis and everybody on the team, including the county partners and the CBOs, for all their teamwork and their hard work, and that she's hoping that the results have an impact on her community, and most of all, that people receive good services. She also wants to thank the people who are in charge or like the stakeholders or the people who can make a difference. She wants to also thank them too. Melida, muchas gracias por estar aquí conmigo. Usted es una amiga mía, muy bien, y me da el placer que en este proyecto tuve la oportunidad de conocer a usted, ¿ok?
Okay.
Thank you, team.
Muchas gracias. Okay.
Gracias, Melida y Mauricio. Now we're going to take questions from the participants. You could go ahead and chat it and I'll read them off. Or if you want to unmute.
So this is Tracy. Let me put my camera back on. I am looking in the chat a little bit, Erica, and I see Nestor's posted quite a lot of information about MHSA and our MHSA 3-year plan and innovation information. So thank you for that. We welcome people to go and check that out. Again, the purpose of this meeting tonight was really to pull this all together and to share with everybody what's come out of this project. And Nestor, you're asking about whether we met project indicators, and you're going to see in a couple slides that we have made some progress. So we'll share that with you. The final evaluation for this project will be done in partnership with the Center for Reducing Health Disparities team, and that'll be made available to the public probably next October when we do our annual update. So I do want to just kind of put that out there that we do have some preliminary outcomes and results, and we are seeing the needle move in the right direction. And if there's other questions folks have, Want to unmute and ask?
We have.
Hi. Oh, go ahead.
No.
Oh, hi, Erica. It's Blanche. It's Blanche Hillman. I was part of this project at the beginning, and I'm so impressed to see how far it's come along. Mauricio, hi, and I'm from the Filipino-American community, and I'm involved with Toro with diabetes support group, which I know that just about every Filipino member in my family has or is at risk for. But this being mental health, I think one, it would be really great to work with Toro and people in training to learn about this issue. They're more of a medical campus, I know, but I feel like if more doctors were aware of this, even if people were coming in for something else, they'd be able to ask the right question to pick up on the mental health issues. And my other thing is, I think that it would be great because we said a long time ago that people would like to see a clinician or whatever that looks like you if they were going to go to counseling. And I thought it would be fantastic if at the high school level or the college level, somehow the separate communities could work towards scholarships to get a Filipino-American or a Hispanic person, interested in going into social work or some kind of counseling or something in the field. And my other thing is that there's a lot of Filipinos already in the medical field as nurses and other things. And it would be great if there was some training, cross-training, and that, because a personal story, my sister was in a coma. My brother-in-law would not go into the room to see her because he was afraid. Our male nurse was Filipino, and I said to him, can you speak to him in Tagalog and tell him why it's important to there and speak to her, that she could still hear you? And he did, and it made all the difference. And I don't know why. That's just a personal story that really made a difference in my family's life. And this person was a nurse. And I think we have lots of nurses, maintenance staff, and all different levels of medical care that are Filipino or Hispanic, or I never remember all the letters, LGBTQ plus. And if we could do some kind of cross training or peer training, even if they don't want to do it one-on-one, they'd be more likely to pick up on it if they're in a conversation with somebody.
Okay.
That's all.
Thank you. I'll go ahead and take the first couple. You mentioned working with Turo. We actually have some students from Turo that are part of our coalition, Filipino Mental Health Initiative Solano. We've also offered the TAG training, the Tulong Alalay at Gabay mental health training for the Filipino community. We had one in December and tried to reach out to the medical field. And we did get some, and if there's still interest, we're happy to schedule another one in the future. Tracy, do you want to?
Yeah, so I'll just piggyback you a little bit and just thank you for the opportunity to talk a little bit more about the career pipeline. So that is something that kind of got put on hold as this project was starting, and even before the particular action plan was developed. We had done a high school career pipeline with the high schools in Vallejo. The following year, we did one in Fairfield with the Fairfield high schools. And again, last year, we weren't able to do it due to COVID. So we're really keenly aware that it's really the best practice would be to grow them from our own community. So to start young in middle school and high school, really raise awareness about the professions that are available in behavioral health. We have a graphic designer. We've developed the outreach materials for when we are able to go back into middle schools and high schools to do those kind of career pipeline days. And then again, with the college level students and interns, really making every effort we can to bring in folks that represent diverse communities So we are going to try and tackle that for sure. I did see a question in the chat about where the posters are being put up. So the posters were distributed, and Erica, you can share maybe where they were put up for the Filipino community in Vallejo, right? Did you guys put them up down there?
Yeah, so in Vallejo, we have them at the local restaurants. So in Cabalan, here in Vallejo, and also in Fairfield. Some of the Filipino grocery stores in Vallejo and also in Sassoon. I think there's a...
Yeah, and then the Latino posters were put up in different grocery stores and businesses and restaurants that cater to the Latino community. They were put into all the county behavioral health clinics and health clinics. And this next batch that was ordered will be distributed to our CBO partners for them to put up in their clinics and office spaces, and then also for our libraries and family resource centers.
And
Can
I mention something very quickly, Erica and Tracy? This is related to collaborating with Tuoro. We also had early in the process a one-day training by two national experts on community-based participatory research, and there was a faculty member from Tuoro that was invited to the training, if I remember correctly. Tracy, is that right?
Yes, it's true, and we actually have there's a different county project that's going on with Toro University right now. We have met with them, we're working closely with them, and they're doing a project that's related to helping folks be able to navigate and get into appropriate mental health services based on their particular needs and insurance. And so they will be promoting our True Care map as well, and many of our other initiatives. So Toro is involved. I think we might need to keep moving. We have another opportunity for questions and answers, but I think if we can move the slide forward, and I think it's Eugene next, my colleague and teammate and friend. Eugene, I'll turn it over to you to introduce yourself and take it away.
Forgot to unmute myself, but good evening, everyone. My name is Eugene Duraw. I am the Ethnic Services Coordinator and MHSA Clinical Supervisor for Solano County Behavioral Health. And this evening, I'll be speaking to you all about some of our outcomes for the ICCTM project. Next slide, please. And so, before getting into some of the details of some of the really great outcomes that we've seen thus far in our project, it's important to note there has been, several different, unanticipated, environmental stressors and impacts on this project over the last several years, with things such as immigration concerns of 2017 and currently attempted rollbacks of don't ask, don't tell, and same-sex marriage, this COVID-19 pandemic, racial unrest and inequality and injustice that we can see, continue to see manifesting throughout our society. And as such, I think, I would like to bring some attention to the resilience that has been demonstrated by our community, as we've continued to persevere through all of these different challenges and circumstances in our society that has made an impact on all of the vulnerable communities that that this project aims to help improve access and reduce stigma for. And one of those projects that kind of signifies the community's resilience is there was a recent act of a hate crime actually that took place in the Vallejo community, and the Vallejo community galvanized, together to actually paint over this hate crime that was at a local park in Vallejo. And if you look at the picture to the top right, it has a painting, a couple of paintings. There were actually a few that the community did, but these two kind of symbolize, you know, really the resilience that has not only been shown by the Vallejo community during that particular event, but throughout all of our partnerships with all of our community partners and key stakeholders and our consumers that we serve as well throughout this project, is that we continue to persevere through it all. Next slide, please. And, you know, as such, we've been able to actually have some really great outcomes. And, you know, one of those outcomes is looking at the utilization of services by race and ethnicity by group per year. And so if you look at this chart, we have circled a couple here for our API community and our Latino Hispanic community as well. And if you notice in reviewing the baseline data, so this is data that was taken from the beginning of our project to most recently as fiscal year 1920. And what we saw in that time frame was a 7.9, almost nearly 8% increase in the API consumers served by our system of care, and nearly 17% increase in Latino consumers served. And as mentioned, you know, we saw an overall decrease in services for, you know, fiscal year 1920 due to the COVID-19 pandemic, adjusting to telehealth and all of the complications that actually grew from that due to people not necessarily having that access to transition to such a level of service. We saw, despite that, we still saw an 8% increase in the API consumer served and a 19% consumer served from fiscal year 18-19 compared to fiscal year 14-15. And so just overall, this graph just really highlights that, you know, we have improved from our baseline of where we started at, and we have served more consumers during that time span, which really is a huge credit to, you know, the hard work of the many stakeholders that contributed to the many quality improvement action plans, and all of the hard work that our community partners and staff and leadership do every day. And to add more details around some other key outcomes. So in comparison of the calls of individuals who actually requested services at the point of access by calling our access hotline number from fiscal year 14-15 when this project began to fiscal year 19-20, we saw a significant increase, so 106% increase in API callers to the access line. And specific to the Filipino community, there was an 86% increase in calls to request services, which gives us an indication that we are providing, you know, a more welcoming space. In addition to the nearly 34% increase in Hispanic Latino callers to the access line, a 425% increase. So we went from 4 in 2014-15 to 21 callers who identify as a gender other than male or female, which also is a credit to, you know, the work that has been done. I believe we have some of our partners that have been a part of some of the trainings that have helped our staff become more welcoming and inclusive in our clinics and all of our workspaces. And so really great outcomes. And then 665% increase of callers who identified their sexual orientation as something other than heterosexual. So I just wanted to, you know, highlight some of these outcomes that, you know, really, you know, are a credit again to the hard work that all of you contributed to this project and our team and leadership. And so as I'm going to pass the mic to my colleague, Alyssa, who will be reviewing the ongoing community engagement and sustainability plans.
Thank you, Eugene. So as Eugene mentioned, I get to share information with you about our community engagement and sustainability as we move forward together. And first, we'll talk about community involvement. We really remain committed to working in partnership with all of you, with our community, with our community-based organizations, and of course within Solano County as well, to keep this work moving forward. So there are several ways that the community can continue to remain involved and that we'll continue partnering with everyone. The first way is for you to continue to participate in the MHSA community program planning process. So every year we have several meetings throughout the county where you can come and help give us input on how we should spend the Mental Health Services Act money. And that's a really great way to participate in mental health policy or mental health program planning. Also, there are lots of county committees you can join. We offer many trainings that we would love to have you attend and participate in. We also hold focus groups and forums. I already mentioned some of them. Right now we're holding suicide prevention focus groups. And that is going to be helpful in updating our suicide prevention plan. We also have events that you can participate in. You can volunteer there. We'll be having a calendar, in fact, for May's Mental Health Month posted soon on our website. And there's also a Filipino Mental Health Initiative, the Solano Coalition, that you can join. Next slide, please. And then as far as, again, continuing the sustainability conversation, the county is, as I mentioned before, really committed to continuing this work in partnership with all of our communities. So some things that we have done to help sustain this work through our contracting processes are adding the class language into our RFPs. So when people are applying for contracts with us, they really have to, they'll see that class language, and that will be kind of at the foundational level at the beginning stages of starting contracts with folks. We also make sure that contracts include a requirement to use class standards now, and our contracted vendors actually have their own cultural responsibility plans. In terms of hiring and retention, both our partners, our CBO partners, community-based organization partners, use the class standards when they guide hiring and retention processes, and the county as well. In terms of policy development, we've added a section to all new policies and all renewed policies called cultural and linguistic considerations. And our CBO partners and other organizations, we really encourage them to use class standards when they develop policies as well. There's also the Diversity and Equity Plan and Committee. So this committee is something, this is actually a committee that Eugene works closely with, and that some of you probably might participate on as well. And we will continue to use the plan to work as a guide for equity to address healthcare disparities. That includes shared decision-making with committees and the communities. We've developed an equity data dashboard, and we continue to support CBO partners to have their own plans and committees all through this Diversity and Equity Planning Committee. Interpreter and translation services have been offered free of charge to all of our contractors, and collaborations in the partnership continue by leveraging partnerships that support ongoing implementation of the action plans. And then the Health and Social Services Community Action for Race Equity, that's the CARE team. They work to take the work of the Diversity and Equity Planning Committee out even farther beyond the Solano County, beyond the government, and take out further into the community through the CARE team and Equity Collaborative. And I will pass it on now to Erica for questions.
Thank you, Alyssa. So we're taking questions or comments that anyone has.
Hi, Erica. Normandy here.
Hello.
Hello all. I'm Normandy, and I used to be a social worker at Solano County for the Older and Disabled Adult Services. And first of all, thank you for sharing all of this information. It's good to hear about the follow through and what's happened to make sure that everything that, at least, you know, from everything that we shared and all the feedback that we provided, like all of that's being put to good use. So it's good to know all of that. So a couple of things, and a piggyback to what was said earlier about scholarships and possibly, you know, enticing, you know, the more people in the pipeline from our communities to be, to look into mental health services as a profession. So that was a great suggestion. And the other thing is about the culturally and linguistically appropriate services. I'm curious as to what this group is doing to make sure that these best practices permeate the entire county health and human services and not just have it be focused within the behavioral health unit. So I kind of want to hear what sorts of partnerships are happening within the departments in Solano County Health and Human Services and Solano County at large, because these are great practices that should be, implemented like at a macro level.
Thank you, Normandy, for that question. I'm gonna defer that to someone from county.
Yeah, so this is Tracy. I can't tell if I got muted for a second because I was typing back to somebody in the chat that had sent me a message directly. So regarding the scholarships, we do currently have funding set aside, MHSA workforce education training funding set aside in our 3-year plan for scholarships for college level interns. And as we implement the middle school and high school career pipeline, we can potentially explore doing different stipends or scholarships as well for that level of student. The other thing that will be happening is there's a 5-year state workforce and education plan that counties are engaging the state with, and we were all broken up kind of into regional sections. We're part of the Bay Area County, so there will also be loan repayment for folks that work under the county mental health plan, so both county staff and staff from our contracted agencies. And this loan repayment will be awarded to people that represent our underserved communities here in Solano County. So those are exciting things that are coming along. And then in terms of our work with our other divisions within health and social services and the community at large, I'm going to pass the mic to Eugene in a second to talk a little bit more about the care team. But I will say we have been invited by different city leadership, law enforcement departments, working closely with our school, the Solano Office of Education, around some of this equity work. And so there is a lot of effort out there to really kind of advance this work and push us forward. But Eugene, if you can say something about the care team and the work that's being done by the department, that'd be awesome.
Yeah, I actually just taking notes on a few different things that I would like to share. So one, in regards to the care team, so the care team actually was formulated a few years ago. So that's short for the Community Action for Racial Equity team. And so that actually came about through participation through the Government Alliance for Racial Equity, which is a national kind of best practice model and organization that actually helps different government bodies throughout the states to be able to, put together different action plans on things they can do to improve equity within their different jurisdictions. And so we participated, our county, and it was a collaboration amongst, various different divisions throughout, our county, specifically within health and social services. However, that also has included community partners such as the library. If you ever get a chance, like the library has a new initiative that actually addresses like equity, and they have book recommendations now to help promote literature, to raise awareness around different, marginalized populations, and to, kind of really, address things and increase awareness, and as well as engage in communities in different ways, utilizing, kind of our library resources. But that's just one example of like collaboration and partnerships, but we also partner between behavioral health and public health on numerous different, initiatives. We share some of our resources internally, to collaborate, such as, efforts to be able to, like we have our, we have to backfill now for our Latino outreach, our OLA coordinator, but we would have different collaborations with public health around like COVID and anxiety and addressing different populations. And so there's a racial equity plan in place, and there's continue to be, ways that and there's also a training that was developed as well that, that was offered to all county employees. So it doesn't necessarily address the class standards per se. However, it is a fundamental aspect or element of the class standards, which is continuously training workforce on, how to provide, better services for, our diverse population. So in essence, it does fall under that umbrella. It's just not, necessarily specifically tied to the class standards, but we do share some of our, practices. And then just a few other things I'll mention, because I can go on a tangent about all of this, and I'm sure Tracy and I can as well. But just a couple other things really quickly. So there are also opportunities that we've been able to share some of the lessons learned through this project. Some of the things that I learned specifically by participating in the class training with some of our CBO partners. I actually helped with reviewing some of our many of our CBO partners, their plans that they're now required to submit that actually demonstrates their adherence to the class standards and what are the different things they're doing locally, which I think is something really to be proud of, that every agency that provides a behavioral health service here that is contracted to do so in Solano County adheres to the class standards and will be developing a class plan. That doesn't happen in a lot of counties that I know of. And then another thing that is really cool is that there's potential opportunities, and I don't know if I'm speaking prematurely, Tracy, or not, but there may be opportunities for us to be able to provide, additional support for beyond just partners here in Solano County, but to other counties throughout the state to share best practices around lessons learned through this innovative project, and specifically around community engagement practices. And so I'll stop there.
Yeah, so if I can piggyback you, Eugene, thanks for the punt. That's an awesome punt. So we are working with the Mental Health Services Oversight and Accountability Commission to launch an ICCTM learning collaborative in partnership with our UCD partners and other community members to launch basically a learning collaborative to learn some of the core components of this project so that other counties can take some of this and really bring it to their own communities and address the disparities in their own communities. So it's very, very exciting. We're still working out some of the details, but we certainly will let folks know. I did want to just respond or mention too, we also are just starting on working on developing commercials. You may have seen some public health commercials about COVID, so we'll be doing some behavioral health commercials, and we're paying special attention to making sure that we're representing the communities that are part of this project, but all of our communities that we serve. So there'll be some commercial content in different languages. So we're pretty excited about that. And then I did see a question that was about money in the budget and how will budget impact this project. So a great question, Linda. A lot of what we're doing, we are going to be able to sustain just by virtue of using our prevention and early intervention funding, our PEI funds. And so a lot of the projects that are focused on outreach, part of what we're required to do under PEI is county-wide stigma and suicide prevention. And so stigma reduction and suicide prevention. So we'll continue to leverage that funding to support that. And then the workforce education and training funding, we have continued support and endorsement from the community to continue to try and recruit diverse workforce. So we'll continue to be able to have funding going towards that as well. So I don't know, Linda, if that answered your question, but with the school wellness centers, we are using some one-time innovation reversion funds to pay for the furnishings and the wall hangings and all the materials that are going in there, but we also will continue to fund Solano Office of Education to implement and support. And then we're asking our PEI programs and some of our other programs, including some of our other divisions within our department, to scaffold services into the wellness center. So we're already, for example, we work with Solano Pride Center, and part of their contract is to provide the welcoming schools model in the schools, and that's the perfect place for them to do it, would be in school wellness center. So we are dedicated to keeping all of this moving forward. And as you heard earlier, we've implemented this into policy, hiring, contracting, everything we do. Other questions? I'm doing a quick time check. I think we have 6 minutes left.
Yeah, we have a question in the chat about the class training. Is there going to be another one, or was that just a one-time thing?
So we won't be doing the full scope class training here again, the same one that was done, but we certainly, from this project, we've really learned quite a bit, not just about the class standards, but also community engagement. And so we'll continue to bring multi-sector folks together. We recognize that the community is best suited to tell us how to fix the problem. And something I share with people and say, people on my team have heard this, we've admired the problem long enough. We actually need to look at solutions, and the community and the multi-sector partners and our CBO partners, Fighting Back Partnership, Solano Pride Center, and Rio Vista Care have really helped get information directly from the community about how we can improve what we do. So we'll continue that process.
Okay, and then we have a question from Fel.
Hi, thank you, Erica, and of course, Tracy and others that have presented at this evening's forum. Maybe first, appreciation. Thank you for Erica and Mauricio in reaching out to me to make sure that I would be able to attend the forum this evening. So I'm looking at that as a liaison's work. And so I was wondering, as far as my clergy colleagues are concerned, especially in Vallejo, it saddens me when my fellow clergy are not really stepping up in engaging the members of their congregation with the community collective work in addressing mental health. And I think a comment that I can share with you with regards to the stigma that as I belong to the Filipino-American community, is how the model minority myth has really affected families not to be honest and transparent with the mental health situations that they are engaged with. And so I was really glad to hear the video earlier of a physician from Kaiser, when she also included the social injustice that we are dealing with and our young people are dealing with. And so I just wanted to lift up that in my role now as a member of the staff of our bishop in the California-Nevada annual conference, I could be an influencer to invite and engage clergy and leaders of our churches in the Solano County, although I live in Loyola County now in Davis. And thank you, Tracy, for the invitation that you sent in the chat earlier. And I'll be more than willing to be a part of this collaboration. So yeah, thank you.
Thank you, Pastor Fel. Oh, go ahead, Tracy.
No, I was just going to thank him for his comments and just really recognizing and standing in solidarity with the API community around the violence that's happening. It's just heartbreaking, and it needs to stop. And I know Eugene and his role in the care team, we're doing some work here internally around addressing that and supporting our staff and our consumers. So we acknowledge these things are happening and shouldn't be happening, but they are. So thank you for all your work out there, the people that are combating that, along with so many other racist acts that are happening in our communities.
Thank you.
Can I say one more thing? I don't think we mentioned early on, and we should have. There will be a separate meeting, probably not exactly the same format as this, but another meeting that will be held in Spanish with the Latino community to address some of the linguistic needs that that community had. So I did want to make sure that we highlighted that for folks.
Thank you, Tracy. So we're going to wrap up at 7:29. So we just want to say thank you. Gracias, salamat po. On behalf of Solano County ICCTM project team, we would like to thank you, all the community members, partners who participated in key informant interviews, focus groups, community forums, organizational assessments, and in the providing quality care with class training. We could not have done this without you. So thank you, everyone.
Thank you, everyone.
And we have the next slide. So these are, Jill, were you going to take that? Probably not. Okay, so these are our contacts. So feel free to email us with any questions you may have. I believe we have a survey that will go out after.
So, am I still muted? So I do want to just to kind of wrap things up too, thanking the community members. I know Sergio just put something in the chat. We could not have done this without the community partners and definitely the CBO partners and our UCD team, all of us coming together and just really appreciating everybody caring this much and carrying this project forward. Just wanted to put that out there. And I'm not sure, Erica, about the survey, how that'll be handled, but yeah.
And hi, everyone. This is Jill. Just wanted to call out, we have some former project coordinators on the call with us tonight. We've got Rico Iglesias, who was with Fighting Back Partnership for a while, as well as Adrian Asban with Solano Pride Center. So good to see you both here. And thank you for all your work on the project.
Yes.
Woo-hoo. Thank you.
Thank you, Adrian and Rico. Good to see you.
I can't see their faces. There you are.
Look at that. That's great.
It's nice to see you all. It's nice to hear these familiar voices.
Likewise.
So happy this has come to fruition. So thank you.
Rico, can we see your face as well?
I'm not sure if my face is showing. But hi, everyone. Thank you for the update. Nice seeing everyone again.
Good to see you, Rico.
Yes.
Good seeing you, Rico.
Yeah, good to see you.
All right. Thank you, community members. We will post this slide deck on our behavioral health website, probably on our, let's see, either our innovation page or our diversity equity page. I think that's where we'll put it. So look for that. We'll get the final slide deck and we'll get that loaded up by Monday morning.
And thank you, everyone. This has been a recorded video, so we can also share the video from our YouTube account for partners to share out as well.
And I want to thank our community partners as well. You know, Solano Pride Center, the Fighting Back Partnership, and Rio Vista Care. It's been just a remarkable journey, you know, teaming up with all of you. And of course, very grateful to the county. Thank you, Tracy, Eugene, and Alyssum. It's just great partners.
Yes, thank you, Tracy and Sergio.
We're having a thank you fest. I love it.
Yeah, well, it's time to celebrate.
I love it.
Yeah.
Gratitude for all that's happened. Yeah.
Right.
Okay.
All right. Well, have a good night, everyone.
Have a good night, team.
Thank you.
A pleasure.
Adios.
Thank you,
Ciao.
Solano Pride, tech people. Tom, you did a great job.
Yes. Shout out to Tom.
Thank you all.
Shout out. Bye.
Bye. Gracias, Melida.
Thank you all. Gracias. Good night.
Gracias a todos. Bye. Good night.
Gracias, Melida. Gusto de verla de nuevo.
Gracias igualmente.